Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Stephanie Desmond. Today, as we enter the fourth year of the COVID pandemic, I talked to Dr. Mike Osterholm, a leading expert from the University of Minnesota, about whether the pandemic is ever going to end and what we need to be concerned about until it does. Let's listen. Mike Osterholm, thanks so much for joining me.
Thank you very much.
So here we are, January 2023, which puts us in really year 4 of the COVID pandemic. I guess I'm wondering, for someone like you, what still keeps you up at night about COVID?
Well, despite the fact that most of the world seems to think the pandemic is over with, it's not. And I keep wondering each and every day when I wake up and look at my crystal ball that has 5 inches of cake mud on it, what is going to happen today? And this virus continues to throw 270 mile an hour curveballs at us day after day after day. And I think that has left a lot of people feeling very uncertain. Well, wait a minute, is the pandemic over? Is it going to be over? What does it mean? And that challenge, I think, both from a psychological standpoint, where many people are over the pandemic psychologically, unfortunately, we're still seeing up to 450 deaths a day. We're still seeing over 45,000 hospitalizations a day in this country. And globally, we're seeing major uptick in activity, not just in China, but in a number of countries around the world.
So you sort of raised the question yourself. I mean, how do we get to the end of this? Will this pandemic ever end?
Well, I'm sure the pandemic will end. I hope I'm around long enough to actually witness that. More specifically, I think that I probably won't personally feel comfortable that it's over with, probably until at least 2 years after it's over. Because every day you'll wake up and say, well, it's been quiet, but could this be the big one? And when you look at the history of this virus, and how it evolved and what happened in the first year, what happened in the second year, what happened in the third year, each one has been different. Is year 4 going to be different? What does that mean? We've surely come to respect this virus for what it does in terms of immune evasion, what it can do to infectiousness. This thing keeps adapting. We're watching what's happening right now in China, which are among some of the darkest days of the entire pandemic. And here we're in year 4. So I think the challenge we're going to have is there isn't a fine definition when the pandemic's over. I guess it's one of those things, to paraphrase a former Supreme Court justice on pornography, I can't define when the pandemic's over for you, but I'll know it when I see it. And I think that's where we're at right now.
How did we get to the point where we still have this many people hospitalized a day? We still have people dying every day. How could we have avoided getting here, and how can we change course?
Well, when we say avoid getting here, I'm not sure that we could ever avoid it. I am not one of those among my colleagues who think you can prevent respiratory transmitted pathogens like coronaviruses from becoming a pandemic. Once the virus is out of the bottle, even in a localized area, it's too late. We've seen this time and time again with influenza. And so I think once that basically spillover occurs, it's on its way. Now the challenge is, what can we do, though, to slow it down, to reduce its impact, to hopefully end it sooner than later? And I think we're all really still trying to understand that. This coronavirus is not an influenza virus. I think this pandemic would have looked somewhat different by now if, in fact, it were influenza. For all we know, this thing could go several more years. There are a group of us that are working on evaluating a pandemic that occurred in the 1880s around the world. And at the time, no one knew what was the cause because we couldn't grow viruses. But over time, it became assumed it was an influenza pandemic. The more we look at it, it very well could have been a coronavirus pandemic. And what's notable about that is it lasted 5 years, and years 4 and 5 were among the worst of the entire pandemic. So I think that we have to keep an open mind to say that this thing is just not going to end because we want it to end. Surely the vaccines, the drug therapies, good respiratory protection, all are important in reducing its impact. But as you can see today, is still substantial. And let me just put this into context, because I think one of the things we're seeing happen is what I call shifting baselines, where, it isn't 4,000 deaths a day. Oh, well, we're in good shape. Well, let me remind you, today we have 452 deaths reported in this country from COVID. Today, the number one cause of death due to cancer in this country is lung cancer. And if you look at the average number of lung cancer cases every day, it's about 350. Now, we would never accept that as being okay. And yet, here we are, more than 100 deaths a day beyond that with COVID, and people are talking about moving on. So I think it is a challenge yet to keep people engaged, to keep them getting their vaccines. Why do we have so few people vaccinated, particularly in the older age groups, where we know that these vaccines can do a lot to reduce serious illness and hospitalizations? Why do we see such poor compliance with taking drugs like Paxlovid, which can do so much to reduce the likelihood of severe illness, hospitalizations, and deaths, as well as even reduce the likelihood of long COVID? Why do we see people who are not wearing respiratory protection that's adequate, an N95 respirator? I can't answer those questions, but they're all in our control. And if we could surely improve on that, we could absolutely dent the impact that this pandemic is having on us.
I understand that sort of the folks who are currently at greatest risk or are dying are older folks. I know it was at the beginning, it was older people, and now again, it's older people. And I'm curious, is it just because they're not taking enough vaccine?
Well, surely we are shortchanged, you might say, in terms of preventing transmission in this older age population because of a lack of vaccine uptake. We know that the vaccines themselves will do only a limited amount to stop transmission of the virus and from you becoming infected. But what they can do a lot is reduce the likelihood of serious illness, hospitalizations, and deaths. And we just aren't taking that seriously. In many locations around the country, less than a third of those individuals who are eligible for these vaccines, who could get them today, are not getting them, and 2/3 are not. This is a huge, huge challenge. And part of it is, I think, the trust in public health. Part of it is the mixed messaging that's occurred. Is the pandemic over or not? And so I think we have a situation today where what we're talking about from a public health messaging standpoint is not what the public wants to hear. That makes it very, very difficult for us to encourage people to protect themselves against this virus.
What does the public want to hear? That's over?
Oh, the public doesn't want to hear it's over. They know it's over. So the challenge is, how do we re-engage them to say, well, not really. Remember those 450 deaths today? They're somebody's mom or dad, somebody's brother or sister, somebody's spouse, somebody's significant other, somebody's kids. Until it happens to you directly in your family today, you may say, well, this isn't a big problem. And yet it is. And so what we need to do is just keep reinforcing that message. I don't want the message for anyone to be, oh my God, one of my family members just died. I guess I better get vaccinated. That would be the ultimate pain for any of us to experience.
So you mentioned China, and I know that there's been talk of closing borders, and that's going to be a way to contain the out of control virus in China, just to China. And I also wonder how feasible that is. I mean, could that really help?
Trying to contain the virus within China is kind of like trying to take 4 sandbags to a tsunami. It's not going to have much impact at all. And frankly, it's more of a political response than anything. And that's true for the whole world. When this virus leaves the border of China, it can go to any number of 100 and some countries. And then that person can have contact with somebody in that country who now gets infected, who, by the way, didn't go to China. And they can infect somebody. And pretty soon that somebody's on a plane to the United States with no thought at all that that individual was in contact with someone who was in contact with someone who actually was infected from China. And so we have demonstrated time and time again, these border closings do nothing to stop the virus from ultimately spreading around the world. And they actually do very, very little to even just reduce the speed at which it moves around the world. So I take it as such. On the other hand, I will say that we do want to get more information out of China as it relates to what's happening with the variants there. There's a big question yet. Will this be a situation with potentially 1 billion people getting infected that we could see a lot more opportunities for variants to emerge? On the other hand, you could argue that because that population is relatively naive from an immunologic standpoint, the virus doesn't have to fight much to continue to propagate itself. So there's not a natural resistance there that would drive evolution like it might in a country like ours. Today, for a SARS-CoV-2 virus to do well in the United States, it's going to have some pretty significant mutational changes to avoid previous immunity and enhance transmission. That may not happen in China, which would say then therefore it's not likely to develop a lot of new variants. And so we don't know what's going to happen there, but we need to follow it very carefully.
Are you concerned about the new variants we're seeing now?
I'm concerned about any variant we see, and I must acknowledge up front, none of us really understand what they mean. I mean, for example, I surely learned my lesson early on in the pandemic when in the end of 2020, early 2021, we saw Alpha take off in Europe, much more highly infectious, causing more serious illness. And everybody said, prepare for the onslaught of these cases in North America. So we did. Well, what happened? It only showed up in Michigan and Minnesota. And in both of those states, it was really a very serious challenge. But for basically 40 other states, it didn't really have much consequence. Now, why was that? What was that all about? We don't know. So the question is, will the XBB 1.5 we're seeing in the Northeast translate to cases across the entire country? What will happen with that? We just don't know. And this is where, if there is one operative word we in science today have to adopt and hold near and dear to our heart, and that is humility. We don't know in many instances what's going to happen here. And I see far too many people willing to make long-term predictions that, frankly, it reminds me that they probably also have a bridge to sell you, and you just can't. We're learning literally every day about and by this virus.
So recent research I saw says that the majority of long COVID cases may have come from people who had mild disease, which of course, as someone who's had mild disease, that's concerning. I'm curious how long-term COVID is likely to play out.
We're still learning a lot about that. And even there, just as we saw early in the pandemic, kids rarely got infected with this virus, at least clinically, we didn't see it. And there were a lot of conclusions drawn that no, kids are not likely to be harmed by this virus. Then, as we saw new variants emerge, that changed, such that with Omicron, we saw over 700 deaths in kids from Omicron. And something changed over time. If you look at long COVID, I think the same thing has happened. The data we have now says that probably the rate of developing long COVID with the Omicron subvariant mix is less than we saw with Delta and Alpha. Now getting infected may pose a different risk for you of developing long COVID than it did before. But the bottom line is there's still a lot of long COVID that's out there in our communities, some of it almost 4 years old, or going into this fourth year, and we still don't understand a lot about it.
What's sort of the one thing that you feel like the public does not understand that they really need to understand as we go into this fourth year?
Well, the challenge is, again, trying to match one's vulnerability or perceived vulnerability to the virus with everyday life. For example, I refuse to let this virus into my social life. We have in our household here a policy that so far has worked very well, where we have get-togethers with small groups. Number one, you can have no contact with anyone known to have COVID in the 3 previous days before the get-together. Number two, if you have even one minor sniffle, you're out of the day out. And number 3 is you have to test negative within 4 hours of arriving at the event. And we've actually had a number of smaller events like this, and we've had wonderful times, and we've had no evidence of transmission, despite the fact around us, we've seen a lot of transmission. So I think it's trying to find the practical ways to deal with these issues. I still can go to concerts. I still can go to the grocery store. I can still go to work. I wear my N95 and I never remove it. Now that means I can't go to restaurants though, because it's obviously you'd have to remove your N95 to eat. But it's trying to find those compromises and those opportunities where you still can live life. So I have my doses of vaccine. I've got my Paxlovid ready to go. I wear my N95. And I put in place sensible practices like I just shared with you about how people can still get together. So it's not an either or. And what we need to do is, I think, if the public could come to understand for the price that they might pay among these deaths that occur every day or these serious hospitalizations, this is a small price to pay to do that.
Mike Osterholm, thanks so much for joining me.
Thank you. It's great to be with you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.